You may begin.
Thank you. I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Here.
Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingracia.
Present.
5 present, you have quorum.
Thank you. The first item on our agenda is approval of the minutes from Wednesday, March 9th, 2022. If any of the committee members have had an opportunity to review those, I would entertain a motion to approve those minutes.
I would like to make a motion that we approve the minutes.
Second.
Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingracia.
Aye.
5 aye votes.
Thank you. The next item on the agenda we're going to move to is Resolution 1. Alderwoman Boyd, you're recognized to present on that.
Thank you, Madam Chair and the Health Committee. I want to present to you all a resolution on Medicare for All. And I have Dr. Ed Weisbord here and his team to explain and kind of go through the process. We did, Madam Chair, we did send the slide and we did send a resolution.
Okay. Sounds good. And I apologize. I looked at item number 1, but we're actually discussing resolution 25.
Yeah.
So just wanted to clarify that. So Alderwoman Boyd, do you just want to let the presenters go and then we can have Alderman ask questions of all of you once they've had a chance to present?
Yes, ma'am.
Okay. All right. So for the individuals who are testifying, I'm just going to swear you in quickly. I'm going to take Dr. Weisbart first. Do you affirm the testimony that you are about to provide is the truth and nothing but the truth?
Yes, I do.
Thank you. And then Chris Wilcox, do you confirm that the testimony you're about to give is the truth and nothing but the truth?
Yes.
Thank you. And Angela Brown, do you confirm the testimony you're about to provide is the truth and nothing but the truth?
Yes.
Okay, so I'll let you all take it from here, and you should be able to share your screen. So let me know if you have difficulties with that.
Thanks so much. Yeah, I decided that we shared the slides, but I decided to maybe for the few minutes just talk without showing slides. So if that's okay, that's
Absolutely.
great. So first off, just need to thank you for how much work you all do being aldermen and women. It's a huge job. And, you know, I never met most of you, but I follow you in the newspapers and my gosh, you folks are busy. So thank you for your hard work on that. Thanks to Alderwoman Boyd for really being a great source of leadership and advocacy and guidance on how to focus on this issue. And thank you to Chairwoman Ingracia for so quickly placing the resolution on the today's agenda. So thanks all that. I and my friends are here representing a coalition of many groups that are asking the city of St. Louis to join with other cities around the country and endorse Medicare for All. St. Louis is just one city. So, you know, why is this important? It's a non-binding resolution. Why is this important? It's important because we're one of many cities. It's not going to by itself change national policy, but Public Citizen has been spearheading this campaign of dozens of cities around the country that are making this statement. The count is, as of this week, is more than 90 cities have now passed resolutions similar to this. And the idea being, with more and more cities saying this, it's one more argument that, yeah, the country is asking for this. So I'm a family physician. I practiced for 20 years in Chicago and then at Washington University when I moved here. I spent 7 years as chief medical officer at Express Scripts. I chair the Missouri chapter of a nonprofit, nonpartisan group called Physicians for a National Health Program. Show Me Medicare for All .org is our group. Like y'all, we all probably have a story that connects us to this issue. And I want to tell you just about one patient briefly whom I saw not that long ago that just is why we need to do this. She had end-stage emphysema, difficulty breathing. She came into our office without her oxygen, which she desperately needs. And I asked her, well, so where's your oxygen? And she said to me, I can't afford it anymore. So in the United States of America and in St. Louis City, we have people who literally cannot afford to breathe. And that's why I'm here. That's why I'm here. That's why I spend all my time on this. So let's be clear about what it is we're talking about. What is Medicare for all? Medicare is the national program of health insurance for primarily people over age 65 and people with disabilities and a couple of other groups, but that's the national program. Medicaid is different. That's a state-based largely program. You've heard a lot of conversation, engaged a lot in Medicaid expansion in Missouri. That's primarily for people below a certain income threshold. That's not what we're talking about today, as critical as that is. We're talking about Medicare, this national program that's today primarily seniors. We're talking about improving it in some important ways and then making Medicare available to everybody in the country. This would have first dollar health coverage. There would be no copays, no deductibles, no premiums, no financial barriers to care like my patient without oxygen. It would also mean we could stop fighting about whether our state or your state is going to expand Medicaid. That's a Medicaid issue, and Medicare, everybody would have Medicare, so you wouldn't need to do those fights. We wouldn't have to fight every few years about whether to renew the Children's Health Insurance Program, CHIP. I don't know if you've noticed, but CHIP is renewed every few years, refunded every few years, and that's going to happen again in 2023. So next year, we're going to have a fight about whether to allow or remove children from their health insurance. And that'll have a huge effect in St. Louis if we don't renew it. Medicare for all would end those conversations. It would also end the connection between employment and insurance. And we know how critical that is. COVID certainly taught us how deadly that can be. So that would no longer be an issue. And we're calling it Medicare for all because it would be built on Medicare, but it would really be better coverage than you have with Medicare. I mentioned no copays and no deductibles, but also adding in the things that we know aren't covered today and should be: hearing, vision, dental, pharmacy, long-term care, reproductive care, and everything else. So it would be funded equitably through the insurance, through the tax model, and even the Congressional Budget Office, as recently as 3 months ago, demonstrated that absolutely this is affordable for the country. For St. Louis, it means better health, right? I mean, the census data most recently before Medicaid expansion showed we had about 30,000 people in the city who are uninsured. So insurance saves about one life for every 1,000 people you add it to who don't have insurance. So numbers range, but that means roughly 300 fewer deaths every year in just the city of St. Louis. And that doesn't capture all the avoidable disabilities and bankruptcies and things that we could have. So Angela Brown will be speaking a little more about that in a couple of minutes. Secondly, it means better finances for the city and for the country. We spend double any other country on healthcare per person, and this would be a big way forward to reduce that. And Chris will talk more about the impact for the city. And just lastly, for reasons, it's just, to me, it comes down to plain old morality. It makes me furious to see the moral injustice of that patient without oxygen. That's what wakes me up every morning trying to fix that. Our coalition includes Mound City Medical Forum, Physicians for a National Health Program, Students for a National Health Program, Missourians for Single Payer, Missouri Healthcare for All, National Nurses United, Missouri Jobs with Justice, Women's Voices Raised for Social Justice, the Metro St. Louis chapter of League of Women's Voters, Consumers Council of Missouri, the American Association of University Women, and local chapters of both the Green Party and of DSA. So we've been meeting for a little while trying to figure this out. Next, I would like to introduce Angela Brown, who is from the Regional Health Commission and actually is CEO of the Regional Health Commission and a real thought leader. And she'll talk a bit more about the public health crisis that she faces every day for people here. Angela?
Thank you, Dr. Weisberg. Thank you to our alderman for allowing us to speak today. Again, as he mentioned, my name is Angela Brown, and I'm the CEO for the Regional Health Commission, and just talking a little bit from our stance of some of the work that we've been doing in the region for the last 20 years. And just to start, access to healthcare continues to be a public health crisis for our community and our country. In the US, we have really developed a sick care system that prevents our most vulnerable populations from accessing healthcare unless they're in an extreme crisis. And when you look at other developed countries, we spend far more on these services that we do provide, with much worse health outcomes and increased health disparities. So we recognize it's time for us to transform our healthcare system into a system that everyone can readily access when it's needed. As we saw from the COVID pandemic, it highlighted longstanding systemic inequities as evidenced by inequitable access to testing and vaccinations, along with delayed treatments for our uninsured and under-resourced communities. We also saw significant increases in disparities for suicides, drug overdoses, and deaths, to name a few. Due to barriers of access and care when you're uninsured and underinsured, we saw a real-time reinforcement of the lack of confidence many in underserved communities have in a system that should be designed to serve them. At the St. Louis Regional Health Commission, we are committed to achieving zero health disparities through a community-driven approach that yields health equity in all policy and outcomes. And as we continue to fight for sustainable health coverage and equitable access, we have been able to provide a bridge in care to St. Louisans through our Gateway to Better Health program. Since 2012, Gateway to Better Health has provided uninsured adults a way to access healthcare until they're able to enroll in other healthcare options. And we cover primary, specialty care, and urgent care services for individuals up to 100% of the federal poverty level. Since the implementation of this program, we have provided access to coverage for more than 66,827 otherwise uninsured St. Louis area residents. From conversations with our patients and providers, we have found that having coverage prevented people from delaying necessary treatment and increased people's perception of their health status. It also increased people's ability to find a job and keep a job because they were able to seek treatment for conditions that limited their mobility. Our providers also felt more confident in their ability to do their job because they were not limited in recommended treatment options based on the patient's ability to pay. So at the REC, we believe everyone has a right to health insurance, and improving coverage moves us closer to achieving health equity. We are proud to stand with our partners across the region and beyond in support of Medicare for All as the most valuable means of ensuring health coverage for all Americans and a step towards achieving zero health disparities in our region. Thank you.
Thank you so much. Chris, are you speaking as well?
Yes. So let me start here. So good morning. My name is Chris Wilcox. I'm a social worker who lives in the 6th Ward, and I work for a Red Circle, which is a nonprofit that serves North St. Louis County, and I'm an organizer with St. Louis Mutual Aid. So I wanted to start with a brief note on Medicare for All, how it would affect the cost of healthcare in the city, how important it is to address the effects of COVID-19, and both short and long term. And finally, I wanted to speak a bit about my experience with healthcare, both as a recipient and a provider. So if I could, I'll share my screen real quick to show what numbers I'm dealing with here. Okay, here. Let's see. All right, can everyone see the fiscal year 2020-2021 average cost of city employee? Okay. So I'm going based on this because it's publicly available. Excluding, so I looked at the Budget Department report on employee compensation for fiscal year 2020-2021, excluding police and fire. The average annual expenditure on salary was $45,779. Health insurance was $7,938. This means that the health insurance ratio to cost of the salary was 17.4% of the employee's salary. So if Medicare for All had been law back then, that cost would instead go to a payroll tax somewhere between 7.5% to 10%. Assuming the tax was 7.5%, that would be $3,433. the savings would be $4,505 per employee, which is about 57% savings. Now let's assume the payroll tax would be higher at 10%. That would be about $4,578 per employee. That means the savings would be about $3,360 or 23% savings. So even if you assume the higher payroll tax, you could put all those savings back into salary. The salary would go from $45,779 to $49,139. And taking all the city's employees into account, there's a lot you could do with that money just from passing single payer healthcare through Medicare for all. And get back. And so Medicare for All will be a vital lifeline for people in St. Louis with regard to COVID-19. In late March and early April, the federal government stopped taking claims for COVID testing and vaccines for people who are uninsured. We know how important these scarce resources are to keep people safe, do effective vaccine outreach, and treat people when they get sick. We know there are a great deal of racial inequities in health insurance. From the Equity Indicator study in 2016, Black residents are twice as likely to be uninsured as their white peers. And outcomes from COVID-19 have borne these inequities out. The white case rate per 100,000 people is just 74% of the same rate for the Black population. And the rate of deaths for whites is just 53% of the rate of the Black population. Now consider also from that what we know about a novel virus, about 10% or more of people infected by COVID-19 are reporting symptoms of long COVID, whose long-term permanence we have no way of knowing at this point. This is likely to multiply existing injustices in health outcomes for low-income families and families of color. Medicare for All will provide coverage for testing, vaccines, and treatment, regardless of race or income. It would also fulfill the long overdue promise of desegregation of our healthcare system. And the last thing I want to touch on is my own personal experience with healthcare in America and those people who have tried to serve. It was while I was in college when I was first diagnosed with anxiety and depression. Simply because of the first time I sought help on my own, it was freely available. Getting treatment for depression suddenly made a lot of struggles in my life make sense. The thing about depression is it can be difficult even to imagine that there is anything worth getting up for. Adding to that, failing to overcome challenges makes it all the easier to gather what looks like a cumulative body of evidence of your own worthlessness. Now, after graduate school, I experienced what every American does when they change or leave a job: uncertainty about healthcare. For me, I cannot afford to not have health insurance, since I am quite a few medications, many of which have withdrawal symptoms when I cannot get them. I would learn this the hard way when I was temporarily uninsured, or had to start the irritating process of working with a new insurer, which is often because of my precarious employment situation. I've had to go through multiple withdrawals because of denials or delays, prior authorizations, or any of the numerous needless bureaucratic headaches we spend hours and hours of unpaid time dealing with just because we depend on private health insurance. One time, without realizing it, I had filled a prescription for my main antidepressant after my coverage expired, and it went through the system uninterrupted. Later, I was sent a bill by Aetna demanding to pay $800 for a month's supply. I'm no longer taking that drug, not because a doctor thought we should change, but because it would still cost me between $100 to $200 with insurance. We deal with so many arbitrary and unnecessary disruptions in healthcare entirely because of our dependence on private health insurance. I've had to change psychiatrists at least twice and had to change therapists at least 3 times because I was working with, the one I was working with was no longer in network. Imagine having to introduce yourself to a therapist that many times and recapitulate all your insecurities and intimate details of your life each time. I purchased a health plan on healthcare.gov because it said on the site that a therapist I wanted to see was in network, only to learn afterward that they weren't after all. And limitations of low-income public health insurance we do have drive some truly absurd outcomes, which I learned when I took a mental health social work job at a federally qualified health center. The pay was low considering the practice required a graduate degree, but worse than that was the rapid pace and intense scrutiny of time. Medicaid has lower reimbursement It has lower reimbursement and a limited pool in Medicare, so companies that take it churn as many billable services as possible, and that's borne by the workers. Imagine being worried about making your numbers while you're trying to be present for a client that is telling you about their suicidal ideation. And then one client I work with was particularly ill-served by every aspect of the system. She fully qualified for Medicaid, but had to borrow money from her brother to get medications for months while she had to prove her disability to establish Medicaid coverage. I was advised to reschedule her appointments so I could pick up other people's appointments to get my numbers of billable services up. This is because she would frequently have to reschedule, which is typical and understandable for someone needing treatment for serious mental health challenges. The very day I was given this advice, the same client texted me a call for help and she was struggling with suicide. After I intervened, she went to the hospital for the second time for suicide before she was finally granted coverage by Medicaid. This was while I was having my own thoughts about suicide related to the conditions of my job, but I had put off seeing a therapist for several months during that time because I was hired late in the year and I would have to pay entirely out of pocket only to have the deductible reset in January. I stayed in that job longer than I should have, while I was having physical symptoms of depression and anxiety, in part because I worried about health coverage. If you've been buying private plans off healthcare.gov multiple times like I have, you will have noticed that they get a little worse every year. The premiums go up, the deductibles go up, and the networks get narrower. Now that we are experiencing a viral pandemic where every aspect of our response is worse because of our existing healthcare system, for a long time I avoided getting primary care practitioner because they would just have to change anyway. And like anyone, I avoided care because I was worried about the cost. Now, none of what I described here is limited by the wealth of the United States or the available medical expertise and technology. These problems simply exist because we choose not to make commitment to care for every person who needs it. This may be even more the case for mental illness, which can be every bit as lethal. It takes courage and resolve just to seek treatment. This fear of being seen as weak or making it up on your head only adds to the barriers we already put between people and care. Without that care that I needed, I may not even be alive today. We know that what we need to do to make sure that everyone gets the care that they need, and that is to pass Medicare for all now.
Wow, Chris, thank you for sharing your story. That was incredibly moving, and I think exemplifies exactly why we're all sitting here today. Before I forget, I didn't see the handouts that I received a few days ago in our folder. So I emailed them to all of the committee members just now. But Chris, I don't think I have a copy of the numbers that you were running and talking about with respect to city employees. Could you make sure I get a copy of that?
Yeah, I can put it in the chat. It's on the budget department's page with the documents.
Okay, yeah, those cost savings were pretty substantial, especially at a time when we can't keep city employees, and a lot of that is because of salaries. So I'm just going to go through the committee quickly to see if aldermen have questions or comments. So Alderman Gunther, you're up first.
Thank you, Madam Chair. No questions really, just thank you to the three speakers. I saw in the chat earlier, another member asked to be added as a co-sponsor. I have a feeling we'll probably just put this in bank later, so I'll hold off on that. But thank you all the speakers.
Thank you, Alderman Gunther. Alderwoman Middlebrook.
Thank you, Madam Chair. I would just like to say thank you to all the speakers. I don't have any questions, and I would like to be added as a co-sponsor.
Will do. Thank you. Alderwoman Rice.
Thank you, Madam Chair. And thank you, Alderwoman Boyd, for bringing the resolution and giving us this opportunity to have this conversation today. I thank you, everyone, for sharing your information, and Chris for sharing your story with us. I also have had challenges with the marketplace, and that was something that, you know, I was one of those that fell in the gap in between my undergrad and my graduate program, that I was actually off insurance for a little bit, and then the national bill passed. I was able to get back on my parents' insurance for a couple of years, and then once I came out of law school, all of a sudden, you know, I was out on my own. And employer-driven healthcare, I think, you know, the younger generations and folks who have found themselves moving between jobs, I guess not even younger generations, folks our Gen Xers and anyone who has ever moved in a job in the US. It's impossible to try to keep up with your care and the options that are put in front of you, and the immense amount of stress and mental drain and time and unpaid time, I'd like the way that you said that, that we spend trying to find care for ourselves and trying to find out ways to pay for these things. And it's just it's a disaster. And I agree, Dr. Weisbart, it is a moral failing of us to not care for each other in just the most basic of ways. And so I'm really grateful to you all for bringing this. I could go on and on. I have nurses in my family. We're big on healthcare for folks that I know. I'm one of those folks who's put off care because I wasn't sure what my costs were going to end up being. I've used the expired prescription plan to pay for something, then had to go back and argue that out. It's such a nightmare, and I feel like the best, most equitable way we can take care of this is Medicare for all. We can do this. And I am grateful that you and the organizations that you work with are bringing this in such a thoughtful way that shows this groundswell of American support that, this is something that is going to come and take care of us. So thank you all for your work. This is really important. And thank you again, Alderwoman Boyd, for bringing the resolution. I agree with Dan. I would just go ahead and make the motion now that we put the resolution in bank for the committee.
Second.
Anyone like
A previous roll.
Hearing no objection to a previous roll, resolution 25 is now in bank. So that means it's sponsored by all of the aldermen who are on this call, in addition to Alderwoman Clark Hubbard, who's not on the committee, but listening in. Alderman Todd, do you have any questions or comments?
First of all, let me thank the panel for coming on, and I thank you for inviting them. I learned so much from the fact that it does save taxpayers' money. It saves illnesses, lives, and so it's a shame that the rich, that money has to go somewhere, since it's being wasted on. It's being taken from somewhere. Money just doesn't grow on trees or just sit there. It look pretty. But the point is that I see this as another thing as citizens that we must do, and as elected officials, as stewards of the taxpayers' money, we must always work for the most efficient and effective way to make sure that our resources for our constituents are utilized in the most effective way. And thank you all again for coming on.
Alderwoman Clark Hubbard, would you like to add anything or ask any questions? Okay, thanks again, Alderwoman Boyd, for bringing this before us. I think it's incredibly important. Thanks to the panelists for the time you spent putting together a presentation for us. I'm sure most of my colleagues on this call can agree. I've definitely been heartbroken trying to support residents who are falling through the cracks all the time. And if I had the money to pay for things like oxygen tanks and other needed things, I would definitely do it. So it's time for a big change. And I think I speak for all of us as well. Please keep us posted on further opportunities to engage and support this effort, because this is a great first step, but there's still work to do. And I'm happy to spend some time in that regard.
Thank you so very much, all of you.
Thank you.
Yep, you're welcome. Does anybody have any announcements?
Oh, I think we just need to make a motion to pass the resolution.
Oh my gosh, I'm not in a hurry. I don't know why I'm skipping around. Thank you. Annie, would you like to do that?
I would. I'd love to make a motion that we pass resolution 25 out with the do pass recommendation.
Second.
Previous roll.
Hearing no objection to previous roll, resolution number 25 comes out of the Health and Human Services as the do pass recommendation. Okay, now I will ask if anybody has any announcements before we adjourn.
I just wanted to thank Rabbi Susan Talby for connecting me with Dr. Wise Boyd, because her and I have been in the trenches for years. And so she brought this to my attention. So I was excited. I just want to apologize. It took so long. It's just been so crazy.
Mhm.
But I just think that this is a good effort for us to help our, as Alderman Todd said, help our citizens in our city. But before the group got on, we were talking about people with insurance through the jobs. And so it's so confusing. It's distraught. This company a change, you paying out of pocket all this money. So I think this is a good move for us as a city. So thank you all for allowing us to present this to you.
Thanks again for doing it. So any further announcements? I'd like to excuse the Alderwoman from the 15th for necessary absence, and then would entertain an motion for adjournment.
Move that we adjourn.
All right. We are officially adjourned. Thanks to you all for your time. Have a great rest of your day.
You too. Stay cool. Thank you.